the big news of the day is that Joe Biden has basically decided that, remember all that monoclonal antibody stuff that Ron DeSantis was talking about and members of the media were suggesting that he was just sort of making it up? Why aren't you focusing on vaccines? And the answer was he was focusing on vaccines. And then for people who did not take the vaccine, or for people who got a serious breakthrough infection, or for people who would not take the vaccine, it is very good to have monoclonal antibodies on hand because they are a very effective treatment from Regeneron. So the media immediately shifted into anti-DeSantis mode, which meant that we were all blowing monoclonal antibodies out of proportion. We really should, it's really not a thing. Why are we focusing on this thing? And not only that, Ron DeSantis is probably doing this because he might own stock in Regeneron, or one of his donors owns stock in Regeneron. It's probably all about that. Well, now it turns out, of course, that Ron DeSantis was correct because, as he has throughout this pandemic, Ron DeSantis has been following the science. And so he ordered a lot of monoclonal antibody treatment because Florida had a really big spike, you may have noticed, this summer. And the treatments that were available included monoclonal antibodies. Well, now the Biden administration has stepped in and they've said, okay, we're no longer going to allow states to simply order monoclonal antibody treatments. Now we're going to federalize the process and, in the process, remove doses from places like Florida, which is pretty obviously a revenge play by the Biden administration against states like Florida and like Texas. Because the idea is that they're going to what? Pick up doses and then not send them where they're most needed? See, here's the thing about the market, especially when you have states who are competing to get a limited supply of a good. The states that have greater need of the good are generally willing to pay more. The states like Florida that were in dire circumstances should pay money, where states like New York were not. And if New York spikes, then New York presumably will want to buy a lot of monoclonal antibody treatments. If states like Vermont, which by the way is 88% of adults in Vermont are now vaxxed, and they have their all-time high in Delta infections because Delta is infectious and herd immunity seems not to be really a thing when it comes to Delta. If Vermont wants monoclonal antibodies, they should go out and get monoclonal antibodies. But the Biden administration has decided, and it is obvious what they're doing, that they seek to at this point, they are basically just rationing medical care. So Breitbart has a very good report on this from Hannah Blow. The Biden administration this week slashed the doses of life-saving coronavirus antibody treatment to Florida, giving the state less than half of what is needed for a routine week, prioritizing what they called equitable distribution. Equitable. Not need-based, equitable. Now, you'll remember that in the public health context, the Biden administration, when they use the term equity, what they really mean is we're not going to give this treatment to the people who need it most. We're going to give it to the people we want to have it most. So they did this first when they proposed the CDC, that they were going to tranche out vaccines, not by age, which is the number one complicating factor for COVID, but instead by race. Remember, they suggested they were going to give a disproportionate number of the vaccines to Black Americans, not to elderly Americans, which made no sense because the actual absolute number of Black Americans who would then die would be higher. Because, again, if you have a certain number of Black Americans who are in the plus 65 crowd, those folks are much more likely to die than the 20-year-old Black Americans. The CDC didn't care. They were going to try and give a lot of doses to people who are 20 and not a lot of doses to people who are 65. And then there was public outcry and blowback, and the CDC revised its own standards. Whenever they say equity, what they mean is we are not going to actually triage this situation and get the doses where they are most necessary. Instead, we are going to simply focus in on who are our political constituencies and how do we get them what they want. The Biden administration this week began to cut the distribution of monoclonal antibodies to red states like Florida and Alabama, contending those states, including Texas, Mississippi, Tennessee, Georgia, and Louisiana, are comprising too big a share of the supply in recent weeks, 70%. Okay, well, shouldn't we actually determine the supply by where the hospitalizations and deaths are occurring? Wouldn't that be the way that you normally do this? It's sort of like saying that you have a heavy urban area and a lot of rural areas, and there are a lot of car accidents in the heavy urban area, but we only have a certain number of doctors who are available for car crashes. And we know that in the rural areas, those people are our voters. So what if we just send all the doctors for the car crashes out to the rural areas, which have fewer per capita car crashes? And those people in the cities, they chose to live there, so if they get in a car crash, really kind of their problem, right? A spokesperson for the U.S. Department of Health and Human Services said HHS will determine the amount of product each state and territory receives on a weekly basis. State and territorial health departments will subsequently identify sites that will receive product and how much, the official continued, claiming the system will, quote, help maintain equitable distribution, both geographically and temporally across the country, providing states and territories with consistent, fairly distributed supply over the coming weeks. And all of the ambiguity lives in that word, fairly. Because again, normally you don't have to worry about what's fair, you just have to worry about who's sick. As soon as you substitute the word fair for ill in that particular sentence, you have decided that the ill don't matter All that matters to you is your political priority, right? Instead, it should be that the geographic and temporal distribution should be rooted in who is ill. Again, they don't care about that. They care about the politics. Governor Ron DeSantis, of course, is cracking back against the Biden administration. And by the way, this just demonstrates the lie. Okay, so first of all, you'll go back like a week and a half. Joe Biden is yelling at the unvaccinated. And one of the things he says in his speech yelling at the unvaccinated is we're going to radically ramp up the amount of monoclonal antibody available to people unless you happen to live in a red state, in which case you're screwed.
We're increasing the availability of new medicines recommended by real doctors, not conspiracy theorists. The monoclonal antibody treatments have been shown to reduce the risk of hospitalization by up to 70% for unvaccinated people at risk of developing severe disease. We've already distributed 1.4 million courses of these treatments to save lives and reduce the strain on hospitals.
So there he was like a week and a half ago talking about how important it is to distribute these monoclonal antibody treatments, right? It's super important to distribute these things. And then he's like, what if we just shifted the way we distribute these things so that the people who are sickest don't get them and people in blue states do? If Donald Trump had done this, you know what the reaction would be. In fact, there were rumors early on, remember? There were all these rumors that Jared Kushner had said, those blue states, they don't need their ventilators. Now, that never happened, right? The blue states got their ventilators. But Joe Biden's actually doing it. Everything they accuse Trump of doing, Biden actually does, and the media cheer like the good little seals that they are. According to Breitbart, the feds have now delivered less than half of the necessary doses to Florida this week. According to CBS 12, they sent 30,950 doses, according to numbers from the governor's office and confirmed by the Department of Health. Normally, the state needs about 72,000 doses a week to meet the current needs on the ground. Christina Pushaw, the press secretary for DeSantis, blasted the Biden administration's move, suggested, quote, every corporate media outlet that publishes sensational stories about overflowing hospitals in the South should first demand answers from the Biden administration about why they are restricting the supply of life-saving COVID treatment to the South. She said supply of monoclonal antibody treatment to Florida, Alabama, Tennessee, Texas, and other southern states restricted by the Biden administration with no real explanation besides equity. How is it equitable to only send treatment for half the Floridians who need it and no state sites in Alabama? So Ron DeSantis slammed Joe Biden over all of this, as well he should. Here was DeSantis.
We are very, very concerned with the Biden administration and the HHS's recent abrupt, sudden announcement that they are going to dramatically cut the number of monoclonal antibodies that are going to be sent to the state of Florida. We think it'll make a difference in these other states, but man, to just kind of pull the rug out from anyone a week after the president himself said they were going to be increasing the distributions by 50%, it's very, very problematic.
It is very problematic. And if you look at the timeline, when he says it's abrupt, it is absolutely abrupt. Phil Kerpen over at the Washington Examiner, he has an entire timeline demonstrating that until like 5 seconds ago, there was an actual guarantee to Florida that they were going to get a certain number of doses, and then everything just switched. Right? As of September 9th, President Biden announced his path out of the pandemic, a six-pronged comprehensive national strategy to combat COVID-19. And he announced that they would increase the average weekly pace of shipments of free monoclonal antibody treatment to states by a further 50% in September. And then September 13th, HHS announced they were taking complete control and doing weekly distributions for all states and territories. That same day, that afternoon, the Federal Department of Health communicated to the Florida Department of Health, communicated to HHS the weekly need for just the 25 state-run sites of about 36,000 doses. When HHS mentioned the state receiving the order for all state sites and distributing, the Florida Department of Health specifically asked if such a shift would apply to all facilities in the state providing treatment. HHS said this was not the case and did not provide any indication of any upcoming limitation to supply. And then, the very next day, they sent an email to all stakeholders indicating a shift to an allocation strategy had occurred that day. And they were contradicting what they had just told the Florida Department of Health. This is obviously and eminently political. And what is this really about? This is really about Joe Biden and the Biden administration determining that if you are in a southern state, you do not deserve the vaccine. This is purely political. Because let's be real about this. There are major population centers in the United States where there's huge levels of vaccine refusal. I'm specifically talking here about black constituencies across the United States. Huge levels of vaccine refusal. And on par or more than quote-unquote Trump supporters. And I'm not seeing any talk whatsoever about denying treatment to people based on that. So if the basic idea is that you get COVID because you decided you didn't want to get a vaccine, and then the federal government says, okay, well, you're on your own because you did that, then that should theoretically be equally applied. Otherwise, what's the excuse? Really, what's the excuse? So Biden himself says, well, it's about Texas and Florida refusing, quote unquote, life-saving measures. What are these supposed life-saving measures? Things like mask mandates. Now, again, mask mandates have been tried in nearly every state in the union. There's very little evidence that mask mandates have done a damn bit of good. When people are scared of the virus, they put on a mask. When they are not scared of the virus, they don't put on the mask, which is why you see in every state, including New York and California, that after a mask mandate is put in place, usually what happens, there's a big spike. The spike starts to decline. And then a government actor, being late on the ball as always, says, mask mandate. And then the spike continues to decline. We're on the other side of the arithmetic curve, right? We're on the other side of the curve already. And they say, well, it was because of this. Right? So the curve looks like this. And then mask mandate comes in here and then it just continues to decline. And then 3 months later, there's a big spike. And where was your mask mandate? Well, very often it was still in place. This is happening all over the place. So he thinks mask mandates are the solution. Or he thinks that forcing businesses to vaccine mandate is going to make this sort of stuff happen. When the reality is, I'm talking to people every single day who are vaccine hesitant, and all that his vaccine mandate nonsense has done is push these people into a harder position. They've hardened their positions. It's now made them more ideologically prone to not only refusing the vaccines, but saying, I'm happy to lose my job. You've turned what was a health decision into a liberty decision for a lot of people, and people are going to double down on what I think is a bad decision with regard to vaccines, but an understandable one with regard to liberty. But here's Joe Biden basically saying, you don't deserve to get monoclonal antibody treatment. That's really what this is about. If you don't do what I want you to do on mask mandates in schools, for example, or if you don't do what I want you to do with regard to vaccine mandates for employers. Now, really, if you were about getting the vaccinated and denying them treatment, then there should be a simple policy, right? It would be a vicious and cruel policy, which is why he doesn't want to do it out loud, but he's just doing it by state and trying to focus in on red states. But if the simple, quote unquote, moral policy here is you don't get vaccinated, you get the disease, you're on your own, that should equally apply across states, should it not? But it's not. Here's Biden.
But we're facing a lot of pushback, especially from some of the Republican governors. The governors of Florida and Texas are doing everything they can to undermine the life-saving requirements that I proposed. This is the worst kind of politics because it's putting the lives of citizens of their states, especially children, at risk. And I refuse to give in to it.
Okay, again, this sort of tyranny from the federal government that Ron DeSantis is the actual tyrant because he refuses to force businesses to mandate that people have vaccines. So Ron DeSantis says you're allowed to be free, make your own call. In the state of Florida, by the way, if you're a business and you want a vaccine mandate, you can still do that. Or you actually can. So Ron DeSantis says that, and Joe Biden's like, he's the tyrant, and it's his fault. So I'm now going to deprive you of the treatment you need. In nowhere else in healthcare, nowhere else in the healthcare field do we do anything like this. It just does not exist. This notion that if you did not take measures to protect yourself and then you get hurt or you get sick, we are going to deny you treatment, that does not exist in the healthcare field. My wife, the doctor, heard about this and she said, what in the world is this? What in the world is this notion that if somebody did not take measures to protect themselves and then they got hurt, that the medical establishment is supposed to refuse them treatment as opposed to triaging by level of risk to them, level of risk to their health, right? Well, this doesn't exist if you're in a car crash and you weren't wearing a seatbelt and they bring you into the hospital, does anybody go, oh, this jackass wasn't wearing a seatbelt. Guess he gets what he deserves. And he's got some pressure from a hematoma in his skull, but we're just going to let that go and just let that brain bleed continue. No one does this. Okay, but Joe Biden is pretty openly doing this. He's punishing states that don't do what he wants by centralizing monoclonal antibody treatment distribution, when the state of Florida was basically doing it on its own already. The state of Florida was already like, we're getting the doses, guys. The Biden administration says the restrictions are in place to ensure every state can obtain enough of the drug. Florida got about 30,000 doses in the last week. Texas ranked second. The goal here really is that he's trying to cut off DeSantis at the knees. Because here's the nice thing for him, Joe Biden. If things get worse in Florida, which they're not, things are much better in Florida. The strain on the hospital system has been relieved. You can see every single curve, including hospitalization and death in Florida, is now down. So we have hit the other side of the curve. We did a couple of weeks ago in Florida. The next curve is likely, the next big spike is likely to be Midwestern and Northeastern. Okay, but the goal here for Biden is if more people die in Florida, then he doesn't have to worry about running against DeSantis in Florida. It's so overtly political. It's insane. By the way, this has been the shtick all throughout the pandemic. Every death that happened under Trump was Trump's fault. Every death that happens under Biden is governor's fault. That's the way this magic happens, according to the media. Biden tweeted something similar. Here is Joe Biden's tweet yesterday. He tweeted out, Republican governors in states like Texas and Florida are doing everything they can to undermine the public health requirements that keep people safe. Really? Because the rates of vaccination, particularly for the elderly in Florida, stack up pretty well against virtually all other major states in the United States. What are these measures to undermine public health requirements keeping people safe? Forcing people to mask up post-vaccination? Forcing children to mask up sans any evidence? Forcing employers to fire people and take the food off their table if they don't want to get the vaccine? He says they're playing politics with the lives of their citizens, especially children. I refuse to give into it. Especially children? The f is he talking about? I've got 3 kids. His kids are all grown. You think I'm playing politics with my kids? I care about my kids a hell of a lot more than Joe Biden does. And I care about my kids enough to know that my 5-year-old should not be forced to wear a mask and eat outside on the pavement every damn day. But apparently I just want to risk the life of my kids, according to Joe Biden. The White House is basically admitting what they are doing. So Jen Psaki was asked about this. She says, we're not restricting supply. We're just, restricting supply.
Over the last month, given the rise in cases due to the Delta variant and the lower number of vaccination rates in some of these states, like Florida, like Texas, just 7 states are making up 70% of the orders. Our supply is not unlimited, and we believe it should be equitable across states across the country.
There's been no reports of a lack of supply, so why cut them to those states only if there's no reports?
I think our role as the government overseeing the entire country is to be equitable in how we distribute. We're not going to give a greater percentage to Florida over Oklahoma, nor do I think are you suggesting that.
Okay, that's insane. And the dismissive nastiness of Jen Psaki really is pretty extraordinary. I mean, that she's dismissing people dying in hospitals. That's what she's doing right there. Okay, it sounds all equitable. If you just say equitable over and over enough, then 3 times and it appears like Beetlejuice. Okay, equity just appears. There's only one problem. You don't tranche out treatments by percentage of population. You do it by who has the cases. There's not an ER on planet Earth that would handle this the way that the federal government is handling this. And it is done purely out of spite. That's all this is. And it's spite for a particular population, namely people they perceive to be Trump supporters. That is what they are doing. And how do I know that it's about Trump supporters and not mere vaccine hesitancy? Because that is perfectly obvious. They are not equally angry at all people who are hesitant to take the vaccine. Depending on who you are, the White House will be your very bestie. They will call you up. They'll try to massage you into getting the vaccine. Only if you're a White House supporter. If, however, you oppose Joe Biden, then go ahead and die, sucker, as Jimmy Kimmel might put it. The battle for the culture is heating up. We here at the Daily Wire are making some big moves. So be sure to like, subscribe, ring that bell, because you're not going to want to miss a single moment.